Hey everyone, on this episode we talk about retearing a rotator cuff repair, criteria for selecting a PT school, and managing athletes with excessive range of motion. The Ask Mike Reinold Show. Helping people feel better, move better, and perform better. Welcome back, everybody, to the Ask Mike Reinold Show. We're here for another episode where we answer your questions. And again, so far, awesome questions. I think we're good. I'm here with the crew here at Champion PT and Performance up in Boston. Lenny Macrina, Dave Tilley, physical therapist here with us. Gabe Morgan, the student extraordinaire that, is your clinical almost over? You've been here forever.
Almost.
2 weeks ago, he's supposed to be done that.
We got another week flying back up just to ask questions.
two weeks ago for Gabe. Fantastic clinical. Gabe's doing a great job.
Killing it.
If anybody in the Georgia area has a job they want to offer Gabe, they can contact you at, what's your Twitter hashtag?
It's at GMO, capital GMO, 5527.
GMO 5527. If you're in the
but
Georgia area and looking for an awesome student, Gabe Morgan's the man. But anyway, yeah, we're back for another show. Got a few questions for you today. I like these questions. These are some good ones today. So, Gabe, let's get it started, man.
All right, first one comes from Peter from Lake Worth, Florida. Peter asks...
From where?
Lake Worth.
Florida.
A lot of lakes in Florida.
Yeah, this is a worthy lake.
Especially in the central area. So Peter asks, is it true that people frequently re-tear after rotator cuff repair and do just as well?
Re-tear after cuff repairs, yeah. So, Len, this is your world.
Yeah, it's an epidemic if you talk to some people, but it
What are we gonna do?
Yeah, just keep having surgery. No, it's if you look at the research, and there's a ton of stuff that's out there, and it continues to come out. We see that the re-tear rates are actually, unfortunately, pretty high. Whether or not they're symptomatic, that's another thing. Some people are reporting 70%, 80% re-tear rates in some of their rotator cuff repairs. So, but people, if you look at their function and functional scores and talk to people about it, they're fine. So we need to figure out, is it that bad that it's showing up on an MRI or some kind of, MRI, but they're functional. So we're going to do anything about it? We're going to have another surgery? Probably not if they're living and doing everything that they want to do. But absolutely, I think re-tear rates exist, and we just need to tweak out what is dysfunctional and what is painful.
Yeah, I think the research shows too, the bigger your tear, so the larger the tear size, the more tendons that it involves,
Right.
or more muscle. So if it's supraspinatus and starts extending down posteriorly, their age, did I say that one yet? Their age, the older they are, the poorer tissue quality, that the re-tear rates go up. So if you just look at size alone, there's a couple of studies that have actually shown this. But again, small tears have, I don't know, I'm making this up off the top of my head, but let's say give or take 25% re-tear rate, medium tears are 50%, and large tears are 75%. So this isn't just one study, this is a bunch of studies, so this is true. But again, the people feel well afterwards. So there's actually, not to get too off topic, but there's been a bunch of research because the physicians started seeing this and started saying, well, maybe we're going too aggressive with rehab. So they start saying some stuff that drives us crazy, like no rehab for 12 weeks, no range of motion for 8 weeks, like those types of things. They start saying these crazy things, but again, the research isn't showing that matters either. So if you start rehab right away, if you start passive range right away, again, that doesn't correlate to the re-tear rate, as far as I know, at least with the research. So yes, it's true. Yes, it happens. Those types of things are occurring, but again, as Lenny said, I think they're doing well because they get such great rehab afterwards, and they really strengthen the cuff around it. So it happens. It's possible, but again, as long as their subjective, complaints are better, I think they're pretty happy. So
Yeah, definitely.
yeah, Gabe, what do we got? What's number 2?
Next one comes from Ari from Boulder, Colorado. Ari asks, I'm a former minor leaguer and I'm starting PT school in the fall. I'm conflicted between choosing a reputable but expensive school versus a lower ranked but less expensive option. As someone who wants to eventually treat baseball players, how important is school ranking?
We get that question a lot, right? Lenny, you have good experience. You've told me about this personally.
I think it's every student that we have in, we hear this a lot from people. Yeah, I mean, I've shifted in my head because I went to Boston University, so I had to choose between UMass Lowell, which is a state school in Massachusetts, was back in '99 or something like that, or Boston University, and I went BU. It had a great experience. I absolutely would recommend BU to everybody. But then you start thinking about, do I want to take on all this debt? And what's really going to shape your PT career in the future? And it's really your clinicals. And I think as long as you have a school that supports the students and their ability to go out and get clinicals that the student desires, not necessarily what the school desires, I think that's the key aspect. If you can get exposed to the climates and the clients and the PTs that you want during your student internships and get the school to reach out to those places. Like I reached out to Health South in Birmingham. I don't know if there was a previous BU student, and I ended up doing my internship down there, and that led to a whole new world for my life. And it's a good thing BU is open to do that. So I think the school, yeah, it's great to have a reputable school, but I don't know if it's as important as students think.
Yeah, I would agree with that personally too. I went to Northeastern. Again, same as Lenny, highly recommend Northeastern as well. Northeastern does have one, differentiation, I guess, that's a little bit, different, is they have the co-op program. So technically, I graduated with, over 2 years of clinical experience more than my peers because Northeastern had that. So there are little things like that, and I think there's some excellent schools out there with some great professors that do things really well, and I think they're out there, but I think in general, this is well overplayed, and I don't know of anybody that owns a clinic or anything else that I know that even cares. Right? Have you ever come across that where you even heard somebody say like, well, I think we're going to go with this guy because he went to this school instead of this school. I don't
Right.
feel like that happens in our profession. We're not talking about an MBA from Harvard here. I think that's a little that's different. I think you get some opportunities. I just don't know if it's there. So if everything's equal, I think it's not about what school you go to. It's about the experience you make, like Lenny said. And so you're a former professional baseball player that wants to get into working with athletes. I don't think your schooling is going to help you get into that niche. It's going to be your experience. So if I were you, I'd be working with every baseball place you could in the area right now, working with all the coaches trying to do that, and just go to whatever school fits your budget or your needs, that type of thing. And I wouldn't overemphasize.
Yeah, my one piece of advice is, as much as schools are interviewing you as a candidate to accept you, I think you interview the school to see how well they work with other clinics to be able to get certain clinical sites if they don't actively have them as a site that you could potentially go to. So I think you want to make sure that the ACCE or the CC, whoever the person is at the college, is open to new clinical rotations that you might be interested in.
Yeah. Dave, you got anything exciting?
No, I mean, when I applied to school a little while ago, I wasn't really looking at rankings terribly. I was looking more at the programs that I thought were a good fit for me, and I also thought that they had, like Lenny said, other friends of mine had gone, or people had gone and said they liked their clinical experience. The teachers were knowledgeable. They had a good curriculum set up, and then from there, like you guys said, like especially like my last year, it was like, what do I want to do? How do I actively pursue more stuff that I want to get interested in? So I don't think it's more of like, a lot of base curriculums have a lot of the same stuff in the last year with clinicals that differentiate. So it's like more about what do you want to put in the last year and find a place to go that you enjoy that will give you connections to wherever you want to go.
And you partly went to Springfield because of their gymnastics
Exactly,
as well.
yeah.
So, so again, Dave went for, a completely different reason why Springfield was a good fit for him. But I don't think any of us picked these specifically because it was a higher ranked school or whatever the heck that means. So, Nice. What else, Gabe?
All right, last one comes from Allie from Dallas. Allie asks, what is the best way to manage athletes who require abnormal range of motion for their sports, such as gymnasts and dancers?
We got a gymnast question.
Wait, I don't know
Lenny,
anything about
what do you think?
Well, my somersault routines.
So
We happen to have Dave Tilley here.
Dave Tilley has been waiting for the word gymnastics to come across
This is probably my page
Gabe's mouth right now. Yeah, exactly. Dave wrote this question.
No.
Dave in Dallas.
So Dave can answer this, but I've forgotten the question. What was it again?
What's the best way to manage athletes who require abnormal range of motions for their sport?
Most athletes require an
yeah,
abnormal
I mean
range
baseball and gymnastics,
Yeah.
but
how do you
want to
manage
know
it?
gymnastics.
How do you manage it?
Sure. So you have to understand the demands of the sport, right? Like you guys restoring an X amount of external rotation is equivalent to restoring X amount of hip mobility in a gymnast, and you have to know what can limit that range of motion, right? All the way from the osseous bony things to the capsular tissue to the soft tissue to maybe they're just super flexible, but they don't have the controller strength to get through their full range of motion. So I took a lot of the research from you guys in like Birmingham from shoulders and applied that to hips because it's kind of the same thing. And oftentimes when you get down to it, you'll find like someone stretching their capsule versus the soft tissue is the issue, or someone maybe has a bony hip anatomy that doesn't allow them to do certain things, but they're still cranking through that range of motion. So that's the first thing, is like a really in-depth assessment of all those things. Once you get to there, a lot of it's education for those athletes that I work with about like you can show me on the table you have plenty of this, why are you still stretching, right? Or like you have enough that you need, you're just not doing it. Maybe it's a technique thing. Maybe their coaches are missing something with their application, you know, all the way down to like we were talking about last week about throwing mechanics, right? Like some people just need more work in throwing mechanics. Some people need more work with you to get soft tissue to get to the coach, because a coach can't coach you out of bad technique until you have mobility for it. So I think there's a lot of components to it about patient education, you know, developing mobility full range that's enough that they need, and then do you have the strength to back it up? Like a lot of gymnasts that I work with get a lot of anterior hip pain and labral issues because they have super strong legs in their mid-range, but when they get to end-range terminal hip extension, you know, they don't have glute control or lumbo-pelvic control, and they cause their issue there. So full range control is a big thing, and then technique at the end, I would say.
Well done. Pretty good. Nice. Gabe, what's next?
That was it.
Oh, that's 3. Wow,
That's 3.
man, we're flying through these. That's awesome. Yeah, good answer, Dave. I mean, obviously, Dave's really, you know, good at this because he deals with people with too much motion all day. Lenny and I deal with people that have too much motion all day.
Sometimes too much is not the issue unless they're symptomatic, though, right? Just because they're Gumby doesn't mean they're like scary.
Right.
Do they have symptoms?
Yeah, I mean,
Can they control the motion? That's
Exactly.
usually the issue. Is
Yeah.
our guys that we see, especially high-level professional athletes who've made it, they have a certain amount of mobility which is needed to throw the ball as hard as they can, but can they control that mobility? And usually fatigue begins to settle in.
Huge. Yeah.
And then that's when the excess of mobility that has gotten them that far becomes a problem, and then they can't control it anymore. So you know, it comes down to fatigue usually.
I feel like all of us too, like Dave kind of alluded to it a little bit here, we all kind of think like addition by subtraction quite a bit. Is most of these people are overstretching. You know, Lenny and I played baseball together at one point in our early lives, and I think Lenny was stretching my arms behind my back and yanking the internal rotation.
Yeah.
That was part of our routine in high school to kind of get loose before the game. That's you know, not ideal. So, you know, as we learn, we'll just, you know, we keep adapting and getting it better. But most athletes are going to have abnormal motion, and you just gotta, you know, we got to get them to control it. So. Well, awesome. Thank you guys. I appreciate it again. Go to MikeReinold.com/podcast. Ask us some great questions. We need more. Keep them coming. We really appreciate that. You know, give us a good review on iTunes. Give us a nice rating on there. We'd really appreciate that. And we'll keep answering your questions. So thanks, guys. We'll see you on the next episode.